In weight loss surgery, one of the questions we get with sleeve and bypass is what happens to the rest of the stomach? So in a sleeve, we take the stomach from the size of a volleyball to the size of a banana. Unfortunately, we can't keep that part of the stomach that we've stapled and separated, so we have to take it out. That goes to the pathologist, they check it and make sure everything's okay with that, and the patient's new stomach is the size of a banana. So the first question the patient has after that is, what if I need that stomach? And the answer is, majority of the 99% of the time, patients don't need that stomach. If for some reason they were to get an illness that required extra nutrition, there are options to put little feeding tubes into the small bowel to help with nutrition. It's very rare and it doesn't happen that often. One of the questions patients will ask, is there an operation that can fail more than the other one? And the answer is really no. There isn't one procedure where a patient will gain back the weight more than the other one. It all depends on using the tool correctly, and that means it depends on the patient a fair amount. Majority of my patients, even though they don't ask it in the seminar, they're all thinking about it. What happens after I lose 100 pounds, 150 pounds? Am I going to have excess skin? What do I do with that excess skin? Is the insurance going to pay for it to be removed? The first thing is, I can never predict who's going to have excess skin. I can look at somebody and think, oh gosh, there's no way they'll have excess skin, and they do, and vice versa. So what we tell patients is, don't worry about that right now. The first thing to do is be healthier. Get rid of your diabetes, get rid of your hypertension, your sleep apnea, and we deal with the excess skin, at least initially, with things like Spanx, clothing, because compressive garments will help tremendously, and a lot of our patients you can't even tell they've had weight loss surgery. Things that impact excess skin, one is smoking. If you smoke, stop, because excess skin is affected by smoking, because smoking impacts the small vessels of the skin and makes it hard for the skin to recoil. Diabetes. Good control of your diabetes is very important, because if your diabetes is out of control, it does the same thing smoking does. It messes up the vessels of the skin and prevents it from recoiling. How fast you gain the weight also plays a role in whether or not you're going to have excess skin. If you gained it very quickly and you have stretch marks, unfortunately the stretch marks, they're not going to come back. Other things patients will ask is, hey, what if I go to the gym and start exercising and toning up and building up a little muscle? And that's great, and it does work in some of our patients, but I can't promise you 100% that's going to work. So that's one of the most frequent questions we get at our seminar, excess skin. After weight loss surgery, a lot of patients will ask, what am I going to be able to do? And the honest answer is anything you want. But one of the things we get asked is there an age limit? And honestly, there isn't. As long as the patients are cleared medically from their heart doctor if they have one, lung doctor if they have one, endocrinologist, and it's safe to do the surgery, age really is not a limitation.